Hi there, this is Dr. Evan Osar with the Institute for Integrative Health and Fitness Education. Welcome to this edition of Integrative Movement Insider for the month of March. Last week, Janice and I were down in the British Virgin Islands celebrating my 50th birthday. So thank you for all of you that reached out via Facebook, Instagram, and or personal emails wishing me a happy birthday. Truly blessed to be part of your journey, and I thank you for all those wishes. It's the most beautiful place we've ever been, so if you get a chance sometime in your life, make sure you check out the British Virgin Islands. From there, I flew to Dallas to present at the IDEA Personal Trainer Institute conference, where I discussed corrective exercise strategies for training the shoulder complex, that forward shoulder, and training clients that have chronic neck and or upper back issues, as well as the knee, ankle, and foot complex. One of the things I shared, especially about the shoulder, is to pay attention to how your clients are aligning, breathing, and controlling, which happen to be the three principles of the Integrative Movement System approach to posture and movement, the proprietary approach that we use with our own clients and patients here in our clinic. So I want to share with you how those principles apply to training your clients, your female clients, and why training your female clients is a little bit different than training your male clients, even though a lot of the same strategies will apply to both males and females. So welcome if you're just joining us for the first time, and welcome back if you've been a part of our community. Now, I'm going to share with you the three keys. Key number one today, and then I'll continue in the series next time. I'll also be bringing experts Janice Maddock and our certified integrative movement specialist here in our clinic, Sarah Fisher, to discuss other strategies that they use with their female clients, because they specialize in working with women after they've had, especially after they've had surgery. Pelvic floor surgery, abdominal surgery, chest surgery, any kind of back surgery. So women after they've had surgery, because so many women have had surgery. And it's very important that you recognize this and ask your clients this, so that way you can help them understand what's going on with their core function and why they may struggle when other clients do very well with the exact same core exercises. So your secret number one, the first key to the three keys, is just that, knowing your client's history. Because I'll give you an example of a patient that came in recently with this exact scenario. Becky came in, she was a very strong, active, fit 60-year-old woman, and she was having chronic low back issues. And she came in to her third or fourth sessions and said to me, Dr. Osar, I was at a party this weekend, and I'm there with all my girlfriends, and we're talking about working out and fitness, and I got down to do a plank. We did a plank challenge, and all of us got down to do a plank, and I was able to hold a plank for 5.5 minutes, much longer than all my other girlfriends. Now, one of the things that we hear in the industry a lot, one of the myths, is that the stronger your core is, the more stable your core is, the less back pain, back tightness, hip issues that you'll have. So here's a woman, really fit, really strong and stable, but still has chronic low back pain. And she still has chronic postural issues that relate to her movement strategy. So the first myth around the first secret is it's not about your client's strength. It's all about their strategy. Their strategy is related to their history. And that's why it's so important that you take a complete history of your client, so you know the surgeries your client has had. Because so many of the clients that we see here, and even when we present at conferences on this very topic, and we have the clients raise their hand, I should say, the trainers, the fitness professionals raise their hand in the class, and this is the same thing whether we're teaching in this country, whether we're over in Europe. It doesn't matter where we're teaching, is a very similar response. And in fact, it's actually more common here, is the number of pelvic floor, abdominal, as well as chest and low back surgeries. Because what we see in our female clients that have had C-sections, hysterectomies, any kind of ovarian cysts and other procedures like that, even if those surgeries were 10, 20 years ago, they're going to have a non-optimal and inefficient strategy for using their core. And one of the most common things we see is women will overly brace, overly pull their abdominal wall in and grip with their pelvic floor. This will disrupt optimal alignment, as well as optimal and efficient neuromuscular control. So the first key to working with your female clients is to take a complete history. And when you're training the female core, to focus upon, or I should say pay attention to, the surgeries that they've had, especially in the chest, abdominal, pelvic floor areas, or low back areas, because this has changed a few things. Their motor control, how well their brain can find and use the right muscles, their strategy, if they've had long-term endurance issues or weaknesses or muscle atrophy secondary to the strategy, or scar tissue, then they are going to develop compensatory strategies that you have to address and not train them just like every other client. Because just because a plank works well for a group of female clients that haven't had surgery, a lot of clients that have surgery, the plank position just perpetuates their patterns. So recognize the impact of surgery, and we're going to have Janice come on and discuss some of the impacts of surgery, and more importantly, or as importantly, strategies that you can use as part of your training program or recommend to your clients to have them go home and do. So, first secret to training the female core is know their history and appreciate their history, because that's what's ultimately determined the strategy that they have when they present to you. So next time at Integrative Movement Insider, I'm going to come back and share secret number 2, and it's one of our go-to strategies for improving the female core, really helping your clients develop more optimal alignment, more optimal neuromuscular control, more optimal and more efficient posture and movement strategies. If you're looking for more information on how to best use your assessments and take that information to create and develop the most appropriate corrective exercise patterns, and then how to integrate this information into the fundamental movement patterns that your clients need to do to safely and successfully achieve their health and fitness goals, then check out the Integrative Corrective Exercise Instructor Program. You can find more information about it at our website, IIHFE.com. During this 3-day intensive, we introduce you to the integrative movement system approach to posture and movement, the best assessments, the most appropriate corrective exercises, and how to integrate this information into the squatting, lunging, bending, pushing, pulling, gait, balance, carry patterns that your clients need to do to perform at their greatest level, so they feel better, move better, and can achieve their health and fitness goals. So check it out. We'd love to see you at one of those courses. In fact, we have Boston coming up next weekend, right after St. Patrick's Day. We also have this weekend the Integrative Movement Specialist Ambassador Program Teacher Training, and this is where we take a group of individuals that have been through our Integrative Movement Specialist Certification Program. They've come back, they've observed additional courses and assisted additional courses, and now we teach them how to teach and educate other health and fitness professionals about the integrative movement system. So if you're interested in any of our courses and really up-leveling your skills, because that's our goal here this year at the Institute for Integrative Health and Fitness Education, is to help you make 2019 your best year ever, so you can more powerfully impact your current clients and get out there and attract those individuals that need, want, and are looking for specialists just like you. So check out IIHFE.com, either on our Instagram page and or our website, www.iihfe.com. You can also find us on Facebook at Fitness Education Seminars and or on our YouTube channel underneath the same name as well. So this is Dr. Evan Osar. Make it a great day, and we'll talk to you later this week from the Institute of Integrative Health and Fitness Education.